Hello, everybody, and welcome to another Speaker in the Spotlight, where you get to meet some of the speakers that are coming up in the Children's Mental Health Matters Summit, which is on the 16th of September, so it isn't far now. If you haven't already got your free ticket, then do visit the Children's Mental Health Matters Summit.co.uk website and you can grab it there. So today we are joined by Kate Beesley, so let me just bring her on. Hello, Kate.
Hi.
How are you?
I'm good, thanks.
Awesome,
Good.
awesome. So without further ado, I'm going to hand straight over to you just to give us an introduction to who Kate is.
So I am a mum to, I've got a 9-year-old little girl. I'm a survivor of domestic abuse. And I've turned my pain into my purpose, so to speak, so that other women and families don't have to go through what I went through. And I've got a very noisy hound there in the background, which you'll hear crunching away on her chew toy.
That's okay. Children and animals are always welcome. You will see mine wandering around. Oh, amazing. And so you mentioned there, so what is your business? How do you help people? What is it that you do?
Yes, so I'm a trauma and domestic abuse specialist, dash risk assessor and educator. So I've trained intensively in the world of trauma. I'm trained in 2 psychosensory methods. One being EMDR, which is the modality that typically the NHS would use. If you are lucky enough to get approved for trauma therapy, which not many people are, and that's primarily because they don't have many professionals within the NHS that are trained in EMDR. It's absolutely ludicrous. It's something I've never really understood, but they plow all their energy into training people up in talking therapies, typically CBT. And not the trauma modalities, and hence why they have such a long waiting list, and you have to be typically at crisis point before you are approved, and even then they only give you a handful of sessions, which isn't enough to deal with the problem at hand. So it's a huge problem, but that is typically the modality that is used within the NHS. But I'm also trained in another modality called havening techniques. And I actually trained directly with one of the doctors who developed the protocol, Dr. Stephen Rudin. So I trained directly with him, which was great. And yeah, I mean, that's definitely my favorite. That's definitely certainly with dealing with, for children. It is very gentle, it's very nurturing, and you've got less chance. It's something you can use to self-soothe as well. So I obviously give havening techniques, along with combining other techniques as well, some bilateral movement and things, and breath work into self-regulation. So this is really important for like children and parents, adults, any adult. So I've done all that training, and then I through my own experience with the police, I ended up down the rabbit hole of training with in coercive control, stalking, and all the other abuse-related crimes, and risk assessments with leading expert in this area, Laura Richards, and I've also trained with Dr. Jessica Taylor as well. Both who have worked intensively within the police themselves. Laura's ex-Scotland Yard, and Dr. Jess Taylor she's a criminal and she's a forensic psychologist, and she's worked within the police and CPS as well. So, I've trained with some leading experts. In fact, Laura created the DASH protocol when she was in New Scotland Yard. So I have something I do pride myself on is having trained with the best in this field. combining that with my own personal, obviously, experience, and bringing in the trauma element, which is all very, very important parts of that, because it's not black and white, unfortunately. So I'm now going to be rolling out training for professionals, which gives them that whole jigsaw puzzle, so to speak. So it helps, it's going to train them in understanding the psychology of the perpetrator and the victim, timeline training, which is all vital skills that you need to demonstrate risk, whether that be for risk for children or risk for adults that are exposed, that are with an abusive partner or being stalked. And I've got resources for the average person, potential victims, parents. So I've published 2 books now, which are aimed to help the average person. And I'm also literally about to, at the end of this month, launch my own radio show alongside UK Health Radio, specifically targeted at educating and empowering and bringing hope to those that may be affected by abuse.
That's amazing, and that is incredible. And having spoken to you like previously, I think there's so much that we can all learn. You don't necessarily realize. So what you are doing is absolutely incredible. I just want to backtrack a little bit for those who are watching that may not know what EMDR and havening are. Could you just give sort of a really quick description of what they are for people that are watching?
So EMDR, like I said, EMDR is typically what you would find if you were lucky enough to be referred for trauma therapy within the NHS. It would be EMDR, which is eye movement reprocessing, desensitization. Desensitization, reprocessing, the way around. So it literally is eye movement. It is literally eye movement. And what it does is it moves. So when we have trauma encoding, the brain takes snapshots of our landscape. So when we have triggers, emotional triggers, when we feel anxiety, we feel angry, we feel upset, we feel hurt, we feel unloved, it's usually triggered, well, not usually, it's always triggered by something within our landscape from our senses. So representing sight, sound, smell, taste. So it could be a word. It could be a word. Now, these snapshots are stored away in our long-term memory. If you think of the long-term memory as a filing cabinet for all our data, and that includes all our academic development, our personal development, and all our survival response, or all our survival cues. They're all stored away in this filing cabinet. If you're certainly with people who have complex trauma, so you'll find this a lot. So obviously this is a children's mental health summit. So with children who have complex trauma, and most of the time they may have trauma from the womb. So they've experienced trauma whilst the brain's been developing. So that means that that container for data they're born with that smaller, because when we have trauma encoding, these adjustments take place in the brain naturally through this encoding. So the amygdala physically swells, which is our emotional part of our brain, and the hippocampus, which is the storage container, physically shrinks, the capacity shrinks. So, but if we have trauma therapy and we can clear the traffic in this container, and we can control our landscape, and these emotional biomarkers in the amygdala can basically be pushed back into the cell, everything can go back to normal. The amygdala can go back to its normal size, and the hippocampus can go back to its normal size, because the brain's pliable. But when you're born with the hippocampus smaller, and the amygdala enlarged, because this has taken place whilst the brain's been developing in the womb. Hence why typically children typically will be diagnosed and labelled. And you know, I don't like using labels. I look at the behaviours and the symptoms, and that's it. Okay, because the brain operates the same, irregardless of whatever label you want to assign. So the way we manage this is the same way. So after birth, the brain, we deal with that container. There's nothing triggering. The cells can go back in. So everything can go back to normal because the brain's pliable. If you're born like that, there's nothing to revert back to, because that's their original state. You're born with that smaller container. Now, although we can manage the triggers, the internal alarm system on the amygdala, but we can only do that if we manage what's going on in this container. So this is where these resources come in, really important. So with EMDR, it's like you're playing the brain's playing a past event on repeat. The tape in the brain is being playing on repeat all the time, because everything in the landscape is saying, uh-oh, there's imminent danger. It could be a word, it could be a sound, it could be a smell, it could be a taste. Everything within their landscape is constantly hitting that internal alarm system, alerting the amygdala to a problem, and it's being validated by that filing cabinet that, yeah, okay, it's not a false alarm. So what we need to do is EMDR moves it from present imminent danger to gone and no longer an issue. Okay, so it's going from present to past. Now, nobody really knows exactly how EMDR works, but what it does do is it creates delta waves. So when we create delta waves in the brain, it makes the brain more pliable, so we can communicate with that part of the brain within the limbic system, the part of the brain that's running the show. EMDR is thought to move from present. If you think of the hippocampus as having two containers, present, past, it's thought to clear it from present container, move it to past. It's no longer representing an imminent threat. So if it's moved to the past container, the landscape is no longer going to be reaffirmed that we've got danger ahead of us. So that's how EMDR works. The problem with EMDR is it's no good for children, absolutely no good for children. And I personally that's not my favorite modality. I use it. I would use EMDR at the end of like a havening session, if I've not got the SUDS down low enough. But it can be quite triggering, because if you don't move, because you're working on eye movement, and it's bringing up, with that eye movement, we're bringing up events that are associated with an emotion. That's what we're doing. So if it hasn't moved from present threat to past threat, we are suddenly, and we're still bringing up through the eye movement, we're bringing up events. You can be left with all these events that you may not have been in the forefront of your mind, and no tool. If you've got no tools to self-regulate, you see you're on emotional overwhelm and emotional shutdown, and that's why you're at risk of having an ab reaction. I actually experienced it when I was doing my EMDR training, ironically, which was probably the best place to actually experience an ab reaction. Because I was surrounded by obviously lots of therapists that could actually bring me out of it. Fortunately, I mean, obviously I had the skills, but because they were there, they could guide me out of it. I could come out of it quicker. Yeah. But you literally go on. It's like you're numb. It's yeah. So I can understand with somebody who doesn't have those skills and the tools to self-regulate, and they haven't got a professional there that is regulating them, how they would be a risk to themselves. Now, I've spoken to mental health nurses who have worked in the NHS, and they've left for that reason, because They value the skills of a psychologist over and above the likes of a psychotherapist or a mental health nurse, who usually are trained in other modalities that regulate the nervous system, like meditation, hypnotherapy, breath work. Psychologists generally aren't trained in that. So they're just, that if they're not following the exact protocol of EMDR, which is to check in on the patient half an hour later after them leaving them sat in the waiting room, then to see if, make sure they're safe. They have to then, or if they don't do that, then they've got to build in regulation time at the end of the session. And if they're not doing either, patients are being left vulnerable. And bear in mind, the only people that do get approved for EMDR on the NHS are really complex cases that have gone really quite severe. So, you know, it's not, I don't like EMDR for that reason, and I would only use it once I've turned that dial down. So that's why I like havening. It's much more gentle. It's touch. And you know, strangely, any therapeutic modality involving trauma, these are things that the brain naturally directs us to. So if you're soothing a baby, you would stroke them. You would stroke them, wouldn't you? Or you'd stroke their face, or you'd rock them. So all these things we naturally do. But the key is to do it in a more controlled way, and bringing in distraction techniques as well, which is obviously what I specialize in through these trauma modalities. But yeah, havening is by far my favorite technique, because it's gentle. It's gentle, it's user friendly, we're able to implement it easily throughout our day naturally. And it's easy to implement with your children as well, with techniques as well. So it's a great modality. And in fact, one of the free resources that I've given you is actually walking them through some techniques. So it's, distraction is really important, because we need to distract the active thinking brain away from reaffirming to the emotional part of the brain that actually there's a problem. So when the children are being activated, we need to just try and not engage, not validate that danger, because if we're challenging them, and it is hard, trust me, I know it's hard. It's hard, because if they're triggering us, they're triggering that younger wounded part of us as well. And it is hard. It is hard. And that's why I always say this is not just about, you have to work on yourself as well as your children. Because if you think of, we are mirrors, we have mirror neurons. We've all experienced where we could have had a great day, gone to pick the kids up, they've come out of school in an absolute foul mood because somebody's been mean to them, or something's not gone their way in school, and because they're in a foul mood, they're kicking off because we are their safe space. They feel safe enough to express how they feel. Well, our nervous system is like, oh, I'm under attack. It doesn't identify that actually this is just a highly emotional child. Let's not engage. But if we feel like we're being attacked and we're caught off guard, it's very easy to react. But all we're doing is going like this. That's all we're doing. And it becomes a vicious cycle. So it's much better in situations like that to just go silent. Just don't engage. Just don't speak. It's better to, it's not silent treatment, because silent treatment goes on for a long time. But if you're just going silent for just long enough to let things calm down, then you can start to engage with them, and you can engage more rationally. But if you start to engage when you feel triggered, and it's just gonna be add fuel to the fire. That's all it's going to do. So this is why it's really important to work on because children are not learned. It doesn't come naturally to be calm and regulated. We're born in a distressed state. So we have to teach them this. We have to teach them to be calm and regulated. Well, if we're not calm and regulated and they learn through observation, that's how they learn from being babies. They watch us and they learn through observation. They will have their eyes fixated on their main caregiver, and they will learn from that main caregiver, and they'll pick up on your energy originally. So if your energy is giving off distress, anxiety, danger, and that's what their nervous system is being taught from day one, and that's before we even look at the womb. So it's really important for us to be calm and regulated, because if we're calm, the situation will diffuse much quicker.
Yes. Yeah.
Because those mirror neurons are not reaffirming danger through the energy. So Havening's a great tool to use with your children. It's a great tool. You can use it with sleep talking and all sorts. There's loads of things that I can teach people with it, but it is an amazing technique. It's one of my absolute favorites. I mean, I use it every single day. In fact, I find I do it naturally and I don't even realize I'm doing it sometimes.
Yeah, it becomes habit, doesn't it? And
Yeah,
that's amazing.
Yeah.
Thank you for sharing so much with us. It's we could talk about these things for hours, couldn't we? Because we're so passionate about them. And if people so all of your links will go with the interview. If people want to find out more about you or more about the things that you offer, do you tend to be in one place more than the other?
I tend to jump around, to be honest with you. I need to get a bit more rigid on where I am. So I have got obviously a Facebook presence. I'm on Facebook, mainly on my personal profile. But I'm on TikTok and I've got a LinkedIn profile as well. And then of course I've got the radio show that's going to be launching at the end of this month. Which obviously you can learn a lot through the radio show where I'll be getting guests on and things. So
yeah, that's amazing. And as I say, the links will go out, and if you want to contact Kate, then please do feel free. So sort of just moving on a little bit, what was it that sort of very briefly, just what was it that drew you into the summit this year?
The root cause of, we are in a national crisis when it comes to violence against women, girls and children. But obviously the national crisis has been announced for women and girls. But, if we look at why we have this problem fundamentally because abuse is becoming normalized in society. And we need to address this with our younger children. If we're the only way we're going to change this through generations ongoing is to address it with our children. Once you're adults, it's a harder fix. Because behaviors are more embedded. Behaviors are more they're default. It's not to say that people don't know what they're doing. They absolutely do know what they're doing. But because unless they have a strong enough desire to change, and this is where we require punishments to represent a greater pain than the wound that they're trying to soothe, because bad behavior is a result of trying to soothe the wound, essentially. That's all it is. So we have to address it from children. And there's more and more people that are seeking a diagnosis for their children's behavior, thinking that, okay, well, if I can get this diagnosis, this is the solution to everything, but it isn't the solution, because all it leads to is more excuses for bad behavior. And at the end of the day, the brain functions the same way, regardless of what label you want to assign to it. it works on risk and reward, and it will always operate to try and keep you safe. And whatever it is associating with danger, remember, the brain doesn't know what's real and what's not real. So a really big common thing that is a big trigger for children is no. And if children are being taught taught that violence and aggression gets people to comply, and it'll be initially the parents that is getting them to comply with what they want. They display violent and aggressive behavior. Okay, well, I need to rein that in. It's triggering me. I feel like this. I feel overwhelmed. Okay, I need it to stop. Okay, I'll just give you what you want. But that's not what we need to be doing. We need to be teaching children about boundaries, their own boundaries, and respecting other people's boundaries. And we need to teach them empathy, to actually have empathy for other people, and understand that their behaviors have consequences, not just for themselves, for other people, but also for themselves. And that has to come from the caregivers. It has to. So that's why I was drawn into it, is because it needs to be spoken about more. And that's why I said to you that, I was a bit concerned that I might trigger people, and I have done obviously a bit of a trigger warning, because ultimately, offenders are getting younger and younger, and victims are getting younger and younger, and none of us would ever like the thought of our children, one, being a victim of any crime, or two, ending up behind bars. So if we want to protect our children from other people and themselves, then we need to clue ourselves up, and sometimes be a bit more tougher. It's needed, unfortunately. There's a right and a wrong way to do it, obviously, but simply giving in is not the answer to this ever-growing problem that we have in society. Because at the end of the day, like Southport, that 17-year-old was somebody's son. So
yeah, we don't want our children ending up
that's it.
Doing something like that. So yeah, well, thank you very much for joining us today and for sharing so many insights within this interview. And if you do want to do grab your free ticket so as you can come along and see Kate's presentation, and if you have any questions for her, then again, do reach out to her, and do stay tuned for another speaker in the spotlight very soon. But for now, thank you very much, everybody. Bye bye.